So we are looking at the full mode series of videos. In our previous video, we've had to discuss about bone graft, which we'll do in this particular video. This is Dr. Arun from Pearl Dentistry, running a dental centers at Chennai, Raja and Amalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos coming out in dental health and awareness. So as discussed in our previous videos, so we had a patient who had multiple missing teeth and very poor prognosis of the remaining teeth. We went ahead and did a CBCT planning for 6 implants, and then using surgical guides we placed those 6 implants, and then the importance of multi-unit abutment also we discussed in our previous video. What other thing that usually the patient might require is something called the bone grafting, because when we extract the tooth, the shape of the tooth root socket might be slightly different from the implant shape and size. So we usually place an implant away from the tooth socket, and then so for the gap that is there, we always fill it with a graft material. That's a bone graft material, so which is part of an immediate implant procedure. So we extract tooth, place an implant, in the intervening gap we place a graft material. So this graft material are basically artificial bone substitute. You can have various sources. It can be taken from the patient themselves. They are called autograft, or they can be either allograft, xenograft, or it can be a synthetic material. Of course, we have discussed in detail about the different kinds of graft material in our previous videos. Please have a look at it. And also we can do what are called PRF. So where we draw the patient's blood, spin the patient's blood, and collect the healing factors that are available in the patient's blood, mix it with the graft material to enhance the healing, both bone healing as well as soft tissue healing. So that's what we have done for this particular patient. Extract, place all the implants, do a graft. So once you have done the graft, we place those multi-unit abutment as discussed in the last video, and then we are coming for the replacement stage. During tooth replacement, we can have multiple options are there when you do a full arch replacement. One kind of an option is called a hybrid replacement. In hybrid replacement, the implants are placed inside the bone. We have the multi-unit abutment based on the patient's amount of bone loss and the soft tissue loss. So we will have a hybrid replacement where we not only replace the tooth structure that the patient has lost, we also replace with a resin material the patient of some portion of the bone structure that is also lost and the gum tissue that is lost. So that's what is called a hybrid replacement is possible. Also, the replacement can also be made of completely zirconia, or it can be made of a titanium bar. On top of the titanium bar, we can also give a zirconia replacement or an EMAX replacement. So these are the various options that are available for the replacement based on the criteria whether we can give a full arch, we can connect it with the bar, and then replace the teeth individually. We can replace the posterior teeth separately on both sides, and then the anterior teeth can be given individually as one teeth at a time. So there are multiple ways in which we can plan the replacement of the teeth based on the patient preference, based on the material of choice, based on what will be the most apt and the ideal situation or the requirement for the patient. Hope you like this video. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearl Dentistry. Bye bye and thank you.